of teeth significantly as well.
That's what you did too, David, right?
Exactly.
What's the story that brought you to Dr. Dan's office?
Well, essentially, as a child, I had a cavity, had a filling, and then eventually that filling, because it's in the back of my mouth, things evolve. You know, eventually it became a crown, and then I'm a grinder, and so eventually it came to the point that a cracking occurred. And then that's when I came to Dan, and we determined that I was a potential candidate because of pressure and grinding and cracking that had occurred over time.
So, Dr. Davidian, what did you do for David to fix this problem?
Well, we actually we recognized that there was fracture and the tooth was not going to be savable long term. The long term success was very low, so we chose a solution where the long term success would be much higher, which was a dental implant. And traditionally, dental implants were placed, you'd take a tooth out, you'd wait 4 months, you'd place an implant, you'd wait 4 more months, and then you could restore it 8 or 9 months down the road.
It takes that long? I had no idea.
Absolutely, absolutely. So many times that's kind of the scenario you're in. When you do some planning and pre-planning and select candidates, you can actually, in his case, we were able to remove the tooth, or not myself, a surgeon was able to remove the tooth, place the implant in the same day. Then after that surgery was over, he was able to come to my office. We were able to place a crown on, a permanent crown, the same day. So he was able to take a process that usually takes 9 months or greater, and it became, you know, a 3 or 4 hour appointment.
Really? So like an immediate fix? Mm-hmm. Wow, and did it affect anything about the way you eat or chew, or have you stopped grinding?
No, in fact, we're going to be talking about a mouth guard here pretty soon. We might have a segment on that.
Say, so take out your old football guard and stick it right in.
Wish it was that simple.
I'm kidding.
But I want to be cautious because there is a healing period. You want to make sure that you have the proper healing process. There's a fusion process that occurs. So right now I'm chewing on the left side of my mouth just to make sure there's no impact on it. We're doing periodic checkups between the oral surgeon and Dan just to make sure that everything is fine and hunky-dory.
Terrific. Well, you know, this is really eye-opening. I had no idea the difference between the older procedure and what you have done. We'd like to put this on our website so folks at home could see the process and how this works. Dr. Davidian and David, thank you so much.
Thank you.
Absolutely. Thank you for having us.